All right, team. The patient presents with enterocolitis, acute hemorrhagic conjunctivitis, and lymphadenopathy. What are your thoughts on the diagnosis?
I think it could be acute gastroenteritis given the symptoms.
It might be viral conjunctivitis since the patient has eye symptoms.
I'm leaning towards lymphoma considering the lymphadenopathy.
Could it be a case of hemolytic uremic syndrome?
No. It's latent period. Epidemiology.
What? What?
I just know. Trust me, it's latent period. Now listen up. We need to perform the Krukenberg procedure on the patient.
Hawks, I don't know of a polite way of saying this, but are you clinically insane? Latent period? That's not a goddamn diagnosis.
Leslie, there's no need for that kind of language. Hawks probably has a good explanation for this.
Oh, this is gonna be real good.
Well,
I think we should run more tests. Latent period epidemiology feels like a Mad Libs kind of answer. That doesn't give us a diagnosis. Just a period of time.
so what next?
I'm gonna have to tell Tracy we have a bit of a crisis. I don't know what's going on with me today. Tracy, I need to discuss a patient with you. I believe we should perform the Krukenberg procedure on them due to their symptoms and my suspicion of latent period epidemiology.
When you say it like that, it sounds even stupider than the first time.
I know. I don't think this is the right course of action or the right diagnosis. Something's a bit off today.
You're right. Normally you want to combat me with your stupid ideas. Today you admit your stupid ideas are stupid. Did you sleep last night?
You hogged the bedsheet and I got too cold.
That is not funny.
You're right.
Anyway, I'm hoping my doctors have run some tests on our patients. I don't feel like I have an answer for anything today.
Oh my God, the patient is in critical condition.
It seems like the Krukenberg procedure wasn't the right treatment for latent period despite Dr. Hawk's insistence.
But Hawks didn't insist on it. Did you perform the Krukenberg procedure anyway?
I may have accidentally done that.
Hawks is gonna be real pissed with us. Given how much we all hate you recently, I'll take the heat for this one. Just stop being you, please.
So, come up with anything yet, Hawks?
Not really. The patient is in critical condition, and I have no clue why. I feel like I woke up with memory loss of how I would approach these cases.
Maybe it wouldn't be a bad idea if you went home.
Yeah, we'll probably figure it out at some point. We all have our off days.
I'm just gonna go get some lunch. I'll see if I come up with something then.
You've really got nothing. This isn't just an off day. This is a catastrophe.
And I don't even have a clever insult for you today. That's how off things are. Catch you all later.
You haven't touched your Salisbury steak in the 5 minutes you've been here.
I think I've lost my appetite.
Are you okay?
Yeah, fine. How are things? For you today?
Yeah, we've had some progress with a few patients. The new treatment plans seem to be working well.
Interesting.
What's been your weird case of the day?
Honestly, I haven't figured it out.
I said something this morning, then realized it was fundamentally absurd.
What was it?
I don't even remember. I think I'm burned out. Like I just lost all of my good ideas in one night.
This reminds me of when you had that spat with Randall a few months ago and you just left in the middle of the day. No one saw that coming.
Neither did I. I was tempted to break into the pharmacy that night, but decided not to. Recently, I've been tapering off the prescription I got a few days before the incident with your cousin.
You should probably talk to your doctor who put you on that.
I think I will.
See ya later, Johnson.
I've made a breakthrough, guys. Forget the protective gear. We've got bigger fish to fry.
Are you insane, Hawks? You can't just barge in here like that.
Yeah, you're putting all of us at risk with your reckless behavior.
What on earth are you talking about? What's this about a new diagnosis?
The latent period theory was all wrong.
I still am not wrong with the patient, but I know the problem is within me, and I must go treat that immediately.
Well, that's great. Couldn't you have waited until we weren't treating a completely different patient in a sterile environment?
Oh, shut up. I appreciate your understanding, Tracy. It was a humbling experience to admit my mistake about latent period.
And what's the new diagnosis?
My doctors will fill you in. I had a quick meeting with them, and I have decided to take a temporary leave of absence.
Is that because you felt off all day?
Yes. I suspect it has to do with my prescription, and I worry that I could make poor judgment calls if I don't get ahead of the problem now.
I'm sure you're going to have a great discussion with your doctor. Do you want me to put a mirror in front of you?
What?
So you can talk to the idiot who gave you those pills? Well, you were the one who prescribed yourself a few months ago.
That is doctor-patient confidentiality, and I have no further comment to make on it.
Just another piece of the investigation, I guess.
Good luck finding witnesses for that. I'm out.